This is Sandy Tankus for TOS50.com, and I'm here this morning with Dr. Lyle Leipziger, the Chief of the Division of Plastic Surgery at North Shore Hospital and Long Island Jewish Medical Center. He's going to be speaking to us today about reconstructive surgery for breast cancer patients. Good morning, Dr.
Good morning.
Leipziger.
It's certainly a pleasure to be here.
And it's a pleasure to be speaking with you. Can you speak to us about how reconstruction has changed over the years?
Absolutely, Sandy. Reconstruction has definitely changed over the years, even since my early training as a resident. The techniques today really afford a woman the opportunity to restore both breast shape and size, yielding really excellent results.
And what are the different types of reconstruction surgery?
Well, there are two broad types of breast reconstruction. One is using your own tummy tissue to try to create a breast, sort of using your own tissue. That's one broad category. The other broad category is using an implant type breast reconstruction. That's usually a staged procedure over time. Both procedures, both broad categories of procedures, really need to be individualized for the specific individual. So what do I mean by that? Well, if a woman has extra tummy tissue and that can be utilized in terms of breast reconstruction, then there's a possible donor area that can be used. If a woman does not have extra tummy tissue and still requires a breast reconstruction, we can do an implant type reconstruction. And there are some reasons that some women may choose one over the other on a very individualized basis.
And if a woman is having implant surgery, I know there's silicone and there's saline. What is the difference?
Well, silicone gel implants came back to the market, FDA approved, back in November of 2006. It's very common today for women to choose silicone gel breast reconstruction implants. The feel of the silicone is much more natural compared with the saline implant, but still it's up to the woman to choose. We give them the option of both, and we allow them to make an informed decision based upon what they want to do. In my practice, I found that about 98% of the women choose silicone gel implants for reconstruction because they find it to be a more natural feeling and result.
And is reconstruction best done at the same time as the surgery to remove the cancer, or are you better off waiting until you're somewhat healed?
Well, years ago, maybe in the 70s and 80s, mastectomy would be performed first, followed by reconstruction. I think the whole paradigm has shifted to a much more modern approach where we're able to start the breast reconstruction at the time of the mastectomy. Thereby, the patient doesn't need an extra procedure in terms of breast reconstruction. By starting it at that time, we have one procedure less that the patient needs to undergo.
How long does the operation take?
Well, it really depends on what you're trying to accomplish. In terms of an implant type reconstruction, it's usually a staged procedure. It can be a three-step procedure where a tissue expander or an uninflated balloon is placed under the muscles of the chest wall as a first procedure. We tend to inflate that in the office over a period of time, could be a few months. Then we do a second procedure where we take out the expander and place the implant, whether it be saline or silicone. And then finally we recreate actually a nipple and a reeler. So depending upon for a staged implant type reconstruction, the process could take 6 months or more depending if the patient requires chemotherapy. For using your own tissue reconstruction, very commonly that's tummy tissue reconstruction, or it could be using other tissue from your buttock area or other areas of the body. Those are actually procedures that are done today by actually lifting that tissue out of that area and placing it into the chest, sewing it with microvascular reconstruction to the arteries and veins in the chest. The other type of breast reconstruction is utilizing your own tissue. Very often it's your tummy tissue, and what happens is we're able to take that tummy tissue almost out of that area and then reconnect it into the chest to the local arteries and veins. That procedure is a more involved procedure. That procedure in the operating room can take many hours, but it leaves you with a breast mound when you leave the hospital.
And if you're only having reconstruction done on one breast, do both breasts match when you're finished?
Well, many women come in with breast cancer making a decision whether to do the mastectomy on the side that requires the mastectomy, or whether to contemplate a prophylactic mastectomy on the opposite side. It's a very personal decision. For the women that choose a one-sided mastectomy, very often we need to address the opposite breast in some fashion, whether we need to lift the breast, whether we need to reduce the size of the opposite breast, whether we need to add volume to the opposite breast. Usually something is done in a procedure we sort of call a symmetrizing procedure to try to create symmetry between the reconstructed breast and the patient's opposite own breast.
Thank you very much for speaking with us today, Dr. Leipziger.
It's certainly a pleasure. Thank you so much, Cindy.
Thank you.